Hello everyone, this is Sheikh Sana from Crime Institute Medical Academy named after S.A. Jayevsky KFU named after Vyavanatsky. Today I'm here to present a short video presentation on my topic fascias and spaces of the neck. Firstly, I would like to thank my professor Igor Vladimirovich Zatempriani who gave me opportunity to participate in this conference and helped me a lot making this presentation. So let's start. Topography of neck. Border of neck extends exteriorly from the lower border of the mandible to the upper surface of the manubrium of sternum and posteriorly from the superior nuchal line on the occipital bone of the skull to the intervertebral disc between C7 and T1st vertebra. When we talk about landmarks of the neck, we are having angle of mandible, external jugular vein, laryngeal prominence, that is the Adam's apple. This is the important surface feature of anterior part of neck as it is the largest part of laryngeal skeleton. Also we have sternal and clavicular heads of sternocleidomastoid muscle, jugular notch, etc. Moving forward to fascias of the neck, we are having classification of cervical fascia by Shevchenko. So, Shevchenko divided cervical fascia into five layers. First, superficial cervical fascia, fascia colli superficialis, superficial layer of cervical fascia proper, deep layer of cervical fascia proper, endocervical fascia, and prevertebral fascia. First, that is the superficial cervical fascia or fascia colli superficialis. It lies beneath the skin and is composed of loose connective tissue, fat, platysma muscle, and some small unnamed nerves and blood vessels. Second, that is the superficial layer of cervical fascia proper. It is also known as the Gruber's fascia. It envelopes two muscles, two glands, and forms two spaces, enteroponeurotic and suprasternal. Third, this is the deep layer of cervical fascia proper, also known as the Risha's fascia. It mainly covers the omohyoid, sternohyoid, sternothyroid, and thyrohyoid muscles. The fourth fascia, it is the endocervical fascia, fascia endocervicalis. It is also known as Pirogov's fascia. This fascia is a sheath of common carotid artery, external jugular veins, and it also envelops the thyroid gland, forming its false capsule. The fifth, that is the prevertebral fascia. This fascia lies in front of the prevertebral muscles, originates from the posterior surface of the sternocleidomastoid, and together with pretracheal layer of the visceral fascia, it forms the carotid sheath. By Shevchenko, this fascial integument of esophagus and trachea. Now let's just talk about spaces of the neck. So there are many spaces in the neck defined by the fascia. First, the retropharyngeal space. This space basically permits the movement of pharynx, larynx, trachea, and esophagus during swallowing. This space consists of loose connective tissue between the prevertebral fascia and the buccopharyngeal layer of visceral fascia. Infections in this space may also extend inferiorly into the superior mediastinum. Danger space. Danger space is located immediately posterior to the retropharyngeal space and anterior to prevertebral space. This is known as danger space because it, there is a high risk that infection in this space can spread directly to the thorax. Prevertebral space. This space includes sympathetic trunk, phrenic and spinal nerves, deep cervical, levator scapulae, longus colli, etc. Carotid sheath. Within this tube lie common carotid artery, internal jugular vein, vagus nerve, etc. Previsceral space. This space is located between the leaves of internal fascia from the level of hyoid bone to the manubrium of sternum. Retrovisceral space. Infections in this space can spread to the posterior mediastinum. 7. That is the space of lateral triangle of the neck. This is the pair space situated between investing and the prevertebral fascia, and it is limited outside the carotid sheath by trapezoid muscle. Now, let's discuss triangles of the neck. So, the sternocleidomastoid muscles divide the neck into two triangles, the anterior triangle and the posterior triangle. First, let's talk about the anterior triangle. So, borders of the anterior triangle. Anteriorly, it is the midline of neck. Posteriorly, the anterior border of sternocleidomastoid muscle. The superior border is lower margin of body of the mandible. The anterior triangle is furthermore divided into four subtriangles, that is, submandibular triangle, submental triangle, omotracheal triangle, and carotid triangle. Submandibular triangle and submental triangle are located in suprahyoid region, while the omotracheal triangle and carotid triangle are located in infrahyoid region. Submandibular triangle borders superiorly, base of the mandible, inferiorly, anterior and posterior bellies of the digastric muscle, layers from superficial to deep, skin, subcutaneous tissue, fascia, fatty space, deep lamina of the fascia. Contents of this triangle anterior and posterior facial veins, part of the facial artery, submental branch of facial artery, hypoglossal nerve, etc. Submental triangle borders laterally anterior belly of digastric muscle, inferiorly hyoid bone, medially midline, floor, mylohyoid muscle, and roof, skin, and superficial fascia. The submental triangle contains the submental lymph nodes which receive lymph from the tip of the tongue, the floor of the mouth, and the mandibular incisor teeth and associated gingiva. It also contains small veins that unite to form anterior jugular vein. Carotid triangle borders superior posterior belly of digastric muscle, laterally medial margin of sternocleidomastoid muscle, medially superior belly of omohyoid muscle. Layers are skin, subcutaneous tissue, superficial fascia, proper fascia, deep fascia, and endocervical fascia. Contents of this triangle are bifurcation of carotid artery, external and internal carotid artery, external maxillary arteries, etc. Omotracheal triangle or muscular triangle. This triangle borders superolateral, superior belly of omohyoid muscle, inferiorly anterior border of sternocleidomastoid muscle, medially anterior median line of the neck, layers, skin, subcutaneous tissue, superficial fascia, proper fascia, deep fascia, and then endocervical fascia. Contents of this triangle are thyroid, parathyroid glands, trachea, esophagus, sympathetic nerve trunk. The next, posterior cervical triangle. Posterior cervical triangle borders are anteriorly sternocleidomastoid muscle, posteriorly anterior border of trapezius muscle, inferiorly the clavicle. Posterior triangle is furthermore divided into two triangles, that is the occipital or omotrapezoid triangle or second omoclavicular or subclavian triangle. Occipital triangle borders anteriorly sternocleidomastoid muscle, posteriorly anterior border of trapezius muscle, inferiorly inferior belly of omohyoid muscle, floor the levator scapulae, splenius capitis, middle and posterior scalene muscle. This triangle is covered by skin, the superficial and deep fascia, and by the platysma below. Next, it is the subclavian triangle. This is the smaller division of posterior triangle and it is bounded above by inferior belly of omohyoideus, below by the clavicle and its base formed by the posterior border of sternocleidomastoid muscle. Its contents are subclavian artery, inferior part of external jugular vein, investing layer of deep cervical fascia, the trunks of the brachial plexus. Thank you for your attention.